Welcome to episode 32 of 2 Cents Tuesday. Recently, I've had reason to interact closely with the health sector in St. Lucia, much more closely than I would have liked. These encounters have reminded me of how complex and costly the business of healthcare really is, and how much we still must do as a nation to ensure proper healthcare for everyone. First of all, there is a shameful situation with our hospital in the south of the island. There can be absolutely no excuse for the fact that over a decade after the fire that destroyed St. Jude's Hospital and caused the tragic loss of lives, and despite the millions of dollars that were mobilized from St. Lucians at home and in the diaspora, as well as significant allocations from the government of Taiwan and other developing partners, citizens in the south of our island still have to access healthcare at a makeshift facility at a sports stadium that is badly in need of repair. No political party has the right or the credibility to speak on this issue, because this problem is one that both parties have failed to solve. In much the same way that no administration should pat itself on the back for completing St. Jude's whenever that happens. It should never have taken us 13 plus years to get this done. How many people have received suboptimal healthcare as a direct result of this facility? The people of the South deserve much better. And the healthcare workers, our doctors, nurses, nursing assistants, technicians, orderlies, and others who have had to work in the stadium hospital for well over a decade certainly deserve much better. Also, let us not fool ourselves into thinking that the problem is solely in the south of the island. While it is disgraceful that for over 10 years we have not had a proper hospital in the south, we also have an embarrassing problem in our new hospital in the north, the Owen King EU Hospital, of which we are so proud. That hospital sometimes does not have pillowcases and enough bed sheets for beds. If it is that our government has to form strategic partnerships with some hotels on the island to deal with this recurring problem, then please do. Although I see no reason, absolutely no reason, why this cannot be addressed with allocations and timely disbursements from the consolidated fund. If we cannot afford to put bed sheets on hospital beds, then what can we afford to do? Patients and their families have enough anxieties to deal with, and our healthcare workers are already overburdened. For us to saddle them with a recurring problem of insufficient bed linen, not in the 21st century. However, the primary purpose of this week's 2 Cents Tuesday is to speak on the affordability of healthcare in this country. Healthcare is expensive everywhere, not just in St. Lucia. This is why providing financial support for people and for poor people and disadvantaged people to access healthcare is such an important social safety net. The government recognized this over 2 decades ago and started a process of health sector reform, which was headed by Dr. Stephen King. I can distinctly remember facilitating a presentation of the Health Sector Reform Committee on Quality Health Services for Life in the conference room of the Ministry of Agriculture sometime around the year 2000 or 2001. I was the permanent secretary in the Ministry of Agriculture at that time. I remember being impressed by the comprehensive nature of the work that Dr. King and his team had embarked upon, and remarking to myself that this would truly revolutionize the delivery of healthcare in St. Lucia. I also remember Dr. King making the case back then for universal and mandatory health insurance coverage for all St. Lucians, regardless of economic means, so that they would be guaranteed access to an agreed package of medical services. On this subject, even at that early stage, over 20 years ago, significant work had been done on what this would cost, what it would look like, and how it could be funded. A few years later, in early 2004, this time when I was the cabinet secretary in the government of St. Lucia, a cabinet that was headed by Prime Minister Dr. Kenny Anthony, I recall convening a meeting of the Commission on the direction of the Cabinet of Ministers to review the terms and conditions of employment of medical practitioners in St. Lucia. That commission was chaired by the late Sir Richard Ritchie Haynes, the distinguished Barbadian doctor and parliamentarian. The report of that commission made comprehensive recommendations for the way in which the Ministry of Health should operate. It recommended how issues with doctors should be addressed, including staffing and remuneration of consultants. It spoke to the empowerment of nurses. It addressed chronic nursing shortages and how we should deal with them, mobility prospects for nurses, and education and training of nurses. The report made recommendations on the operations of Victoria Hospital, which at the time was our only hospital in the north. OKEU had not yet been built. St. Jude's Hospital, the Mental Wellness Institution, which at that time was Golden Hope Hospital, and the Soufriere and Dennery hospitals. It also spoke to issues of bed utilization at our various hospitals, the physical conditions at the hospitals and health centers, and our ambulance services. Over 110 people were interviewed by the Commission in conducting its work. The report of the Health Review Commission was presented to the Cabinet in September 2004. Again, that's over 18 years ago. 2 years later, the National Strategic Plan for Health was completed. It would be very interesting to see how many of the recommendations from these reports have been implemented, but we should not be surprised if that number is very low. In a previous Two Cents Tuesday, I spoke about our love affair in St. Lucia with generating reports that we do not or very seldom use. Therefore, between the extensive work that was undertaken by Dr. King's team on health sector reform and the substantial recommendations of Dr. Ritchie Haynes' commission, we had enough source material to have embarked on a comprehensive and revolutionary reform of our health sector over 15 years ago, and to have started the ball rolling on universal healthcare. In fact, I distinctly remember a pilot diabetes and hypertension universal healthcare program being started sometime around 2005. However, this fizzled out sometime after 2006, and sadly, except for the construction or rehabilitation of some wellness centers, which is how we call health centers these days, and the construction and commissioning of the Mental Wellness Center and the OKEU Hospital, very little has changed with the operations of our healthcare system in St. Lucia. The dream of universal healthcare, where everyone, regardless of economic means, has access to a package of guaranteed health services, remains but a fleeting illusion to be talked about and written about in political speeches and manifestos, but never attained. Meanwhile, cancers, stroke, heart disease, diabetes, and hypertension, in that order, ravage through our female population as the principal causes of death, while cancers, stroke, heart disease, diabetes, and COPD, closely followed by assault and hypertension, are the leading causes of death, again in that order, among our men. If we want to get a good estimate of the number of people in our country who desperately, urgently need healthcare, but cannot afford to access it, look at the number of people who took advantage of the Miracle Eye Care program that was conducted some years ago by the government of St. Lucia in conjunction with the Cuban and Venezuelan governments. Or, more recently, look at the file footage of the long lines that showed up to get treatment from the US Navy hospital ship Comfort when it berthed in St. Lucia in September 2019. That was just, 3 years ago? This should give you a good indication of the large numbers of people who know that they are unwell, but will not go to a doctor, polyclinic, or a health center, a wellness center, because they believe, they know they will not be able to afford the cost of treatment. So instead, they prefer to suffer with the persistent headaches, the serious vision problems, the pains that instead of going away keep getting worse, the sharp chest pains, the difficulty urinating, the bloody stool, the shortness of breath, and all the other telltale signs that something is wrong in or with their body. For some, their comfort is to blame whatever they are experiencing on gas and take something that will make the gas go away. It cannot be right that so many of our citizens are having to make these life and death decisions because we have failed to give them access to a guaranteed package of health services. It is also not right that as a government, we have not made the provision of proper, affordable healthcare a basic right to which every citizen in this country is entitled. Our priorities, unfortunately, are wrong. Very, very wrong. Therefore, my plea to the powers that be is threefold. Firstly, please give the citizens in the south of the island the proper hospital to which they are entitled. To the politicians who still have the temerity to try to gain political capital from this situation, please go find something else to speak about. No one has the legitimacy or the credibility to speak on this subject. Secondly, let us engage in a comprehensive program of health education, starting in our primary schools and going all the way to adulthood. The messages must be consistent and persistent. People need to be made to understand the consequences of some of the lifestyle decisions they are making. The high salt, high sugar, imported processed food diets are killing us. Government needs to disincentivize the consumption of these foods with higher levels of taxes if necessary, the proceeds of which should go towards funding universal health care. Let this also be linked to a grow your own food, eat your own food national healthy diet program. Let us link agriculture and farming with health in our country. There should be a higher tax on tobacco, again, with the proceeds going to the universal health care. I've seen too many of the guys I grew up with in Coral Street, Grass Street, and Baccarat succumb to COPD. That has to stop. There is a big elephant in the room that no one wants to talk about or touch. We have a serious alcohol abuse problem in this country, and we must deal with it. And finally, we have studied and overstudied the health sector in our country. We know what needs to be done. What has been lacking is the willpower to get it done. Let's do it. Please, please make the health of our citizens the government's priority for the next 3 to 5 years. Let us embark on a campaign to make St. Lucians the healthiest people in the Caribbean, starting with the implementation of universal health care, which will allow us to treat the large numbers of people who are not well but cannot afford treatment. Like my good friend, Dr. Stephen King, has often told me, a functioning health system concerns itself with 3 things: prevention, intervention, and rehabilitation. Let these be our preoccupations for a while. Everyone will benefit. Thank you for viewing another 2 Cents Tuesday. Have a good week and please stay safe. Goodbye.